Hello, my name's Dr Adelina McLeod and I am the Chair of the Trainees and Members Committee at the Royal College of Physicians, Edinburgh. Today I have with me Dr Rod Harvey, who is the Director of Examinations at the Royal College of Physicians of Edinburgh. And we're here today to talk about the changes to the new PACES exam coming in 2020. Good afternoon, Rod.
Good afternoon.
So, from a trainee point of view, what fundamental changes can they expect from the new PACES examination?
Well, I think before I actually come to that, I think the most important thing is to stress what isn't changing, because the changes really are going to be quite evolutionary rather than revolutionary. So although there are significant changes, I think people should not be too put off by the prospect of the change. So the things that definitely are not changing is the format of the exam will still be a 5-station carousel that takes a total of 125 minutes to complete. It will still test the same 7 skills, and it will involve testing by 10 examiners independently at the 5 stations. What has changed is the content of some of the stations. Most importantly, probably to think about the current Station 5, which is currently brief clinical consultation. That will disappear in the new exam and will be replaced by 2 separate, longer clinical consultations. At present, the brief clinical consultations allow 8 minutes interaction with the patient and 2 minutes with the examiner, followed again by that immediately again. In PACES 2020, there will be a single encounter at Station 2 and 5, which will last 15 minutes with the patient, during which the candidate would be expected to take a history, rather more comprehensive history than at present, do a focused physical examination, address the patient's concerns and formulate a management plan. And that will be followed by a 5-minute interaction with the examiner. So that will provide quite a lot more time than in the current brief clinical consultation, which many candidates and the examiners find quite rushed. So essentially, you can think of it as Station 5 being divided into 2 new longer stations with the same fundamental format, but expanded. It will test the same 7 skills in those 2 stations, 2 and 5.
Okay. So just to summarise what you've said, the format of the exam is the same with the 5 carousels. Yep. It's just that Station 5, where you originally had sort of 8 minutes with a patient with potentially very little time to examine them, that's now going to be elongated and you'll have longer with the patient, which is perhaps a little bit more closer to what happens in real life.
It's more akin to what you might expect in, say, an outpatient consultation, and I don't think many outpatients would be timetabled to last less than 15 minutes for a new patient. So yes, you're right. So that's one key change, but there are more changes which I probably should come to now.
Okay, yeah.
So the other main change is that the current history-taking station has been retired entirely. So that's current Station 2 will disappear. Part of the reason for that was it was felt to be a little bit artificial to expect a candidate to take a history and then formulate a differential diagnosis and management plan without recourse to any physical examination. So the history-taking now will be entirely tested within the new clinical consultations encounters. In place of the history-taking station, we will have 2 new communication encounters. These are akin to the current Station 4 communication skills and ethics. In fact, they are almost identical to them in format, but are shortened. So rather than lasting 14 minutes as at present, the new communication encounters will last just 10 minutes. Importantly, that 10 minutes will be spent entirely with the patient or surrogate, and there will be no interaction between the examiner and the candidate. So the candidate will have to demonstrate all of the skills in the interaction with the patient, including clinical judgment. And that's a very key change that I think candidates are going to need to realise. Those communication encounters will occur at 2 separate points in the exam. One will be in Station 1, followed immediately by a respiratory examination exactly as at present in the other half of the station, and the other will be in Station 4 when it will be followed by an abdominal examination exactly as at present. And those really are the key changes. And the one station that has not changed at all is Station 3, which is neurology and cardiovascular examination. That will be exactly as in the current PACES.
Okay. So I suppose candidates, rather than having the 2 separate stations where they did 2 examinations, one after the other, they have a bit more communication and then followed by an examination.
Yes, exactly. So that examination station, was station 1, which was respiratory and abdominal, is essentially split across 2 stations with the communication encounter always preceding the physical examination. And I think that's an important point because candidates will have an introductory material to read outside the station for the communication encounter, so they will never be expected to remember that while they're doing the physical examination. They'll go straight into the communication encounter, fresh from having read about it, and then immediately after that we'll then do either a respiratory examination station 1 or an abdominal examination station 4.
Okay, thank you. So is that all that's changed with the PACES exam?
That's really all that has changed from the perspective of the candidate. Obviously, behind the scenes, a little bit more has changed. For example, the total number of marks available is slightly different. Because we don't have the history-taking station and we won't be testing differential diagnosis in that, there are actually 2 less judgments tested overall, which means there are 4 less marks. So the maximum score available is 168 in PACES 2020 compared to 172 in the previous exam. That will mean that the pass mark will need to be adjusted. And indeed, because the exam is changing, albeit subtly, we need to re-establish the pass mark and make sure that the new exam is calibrated to be at the same standards as the old one. And that means that for the first few diets, it won't be possible to have a fixed pass mark, but it will be necessary to calculate the pass mark once the actual scores are known using a statistical method known as the Hofsey method, which is quite widely used in assessment methodologies.
So what does that process mean for trainees? Will they get their marks at the same time, or?
What it means for trainees in the first 2 or 3 diets, certainly the first 2 diets and probably the third of PACES 2020, is that the results will be delayed in being released. At present, candidates can expect to receive their result within 2 working weeks of sitting the exam, so about 10 working days, 2 weeks. Unfortunately, in the new diet, it will be necessary for 90% of candidates to have actually sat the exam, and the exam runs over a 2 to 3 month period, before we can actually determine the actual pass mark. And until we know the pass mark, we obviously can't release the results. So that really means that the results won't be released until the end of the diet. So for the first diet in the autumn of 2020, the results will be released probably on the 6th of December. Right. And for the second diet, which will be the first diet in 2021, we expect it on the 11th of April 2021. Okay. Now we are concertining the diets, making them a little bit shorter over a shorter period of time to try and mitigate that a little bit. But we are aware that is an issue for trainees, particularly if they're needing the result in order to progress within their career.
Yeah. So if a trainee is to sit the exam, there is that just for I think just for the first sort of potential year or so of it running, there will be that delay. What about candidates who need to think about rebooking their exam? Will they have their grades in time?
Yes, that's a really important point. They will have their grades. The booking period for the subsequent diet will have opened before the results are available. But it will not have closed until after the results are available. Okay. So there will be quite a narrow window of opportunity if someone unfortunately finds that they have failed for them to be able to then book in for the next diet. But that will definitely be possible. Okay.
And will these changes affect the fast track, the current fast track system?
It will affect it a little in the first year. This year it will be unaffected. So if anybody wants sitting it in June, July this year, 2020, that fast track will run as normal. Fast track doesn't normally run in diet 3s in the autumn, so it won't be affected for the first diet of PACES 2020 because it doesn't run anyway. Normally, in the first 6 months of any calendar year, a candidate would have 4 opportunities to sit PACES. 2 opportunities within the normal diet and 2 opportunities within the fast track. In 2021, there will only be 3 opportunities because there will be only 1 fast track run, which will be approximately in May 2021. Logistically, because of what I've been explaining about the delay in the results, it's just not possible to run 2 fast tracks in that period of time. So that means that candidates will only have 3 chances to sit paces in the first 6 months of 2021, whereas in the past they would have had 4. In reality, that will affect a very, very small number of people. Over the last 2 years, I think either 1 or 4 candidates overall have actually sat 4 times. So we would expect it to affect less than 5 candidates from the entire cohort sitting.
Okay. I suppose a lot of people might be thinking about why we had to change the exam. I would just wonder if you could elaborate on that.
Yes. Well, I suppose like anything, there is a need to refresh as things move on. It's quite important that the exam is kept aligned to the internal medical curriculum, the new IMG curriculum. And there is an increasing emphasis on, rightly so, I think, on communication and communication skills in medicine generally. And the exam has been calibrated, or not really calibrated, has been adjusted, if you like, to take account of that, and in particular, that's why we now have the 2 communication encounters. I think it's also people have actually looked at the current exam and realised that although it has many strengths, there are also weaknesses, and that Station 5 in particular is seen as time pressured for the candidates and also actually quite difficult for the examiners. The distribution of the marks across the different stations is quite inequitable. So, for example, Station 5 carries 33% of the marks, whereas Station 4 contains, I think, just about 16%. So there's a big discrepancy across the marks available in the different stations. And so both for keeping in track with modern practice of medicine, making sure that it's in line with the GMC curricula, and also simply actually taking the opportunity to improve it where it's recognised to be have some weak areas, are all the reasons why we need to make this change.
So taking what you said, does that mean that for each station the weighting will be similar between stations now, whereas before it was quite heavily weighted?
It's much more similar. It's not completely equitable. So 4 out of the 5 stations now test all 7 skills. So the only station that doesn't test all 7 skills is Station 3, which is doesn't have communication within it. The marks available are much more evenly spread. So the maximum number of marks at any one station now is 40, whereas it used to be, I think it used to be 58.
Do you think these new changes, how do you think these new changes affect the validity of the exam?
Yeah, obviously when you change anything, by introducing change, you're potentially introducing risk in terms of will the exam actually pass the same candidates from when you move from one to the next. That's really why a lot of effort is being put into adjusting the pass mark in order to make sure that as far as possible the same proportion of candidates will pass the new exam as the old exam. So in that sense, I think we are confident that actually the exam will maintain validity over time. Now, clearly there are subtle changes to the content, and so some candidates may find it a little bit harder for them personally, and equally other candidates may find it a little bit easier for them personally. So although proportionately I would expect the same proportion of candidates to pass in the new as the old, and the pass mark will be adjusted to, as far as possible, achieve that broad aim. Within that, it's obviously impossible to say that a candidate A would pass in one exam and definitely candidate A would pass in the next exam. But I think we know that even in the current one, if the same candidate sits paces twice, they don't necessarily pass it or fail it twice, even if they do it on 2 consecutive days. So there's variation on individual performance. There's a little bit of variation on what you come across inevitably because it's a clinical exam.
Yeah. So with all of these changes to the exam, what training have you put in place for examiners? Okay,
so all of the colleges are running training and awareness days for examiners, both face-to-face and also online. The formal training will be run from the Federation, because the MRCP is a federation of the 3 colleges, and examiners will be required to have satisfied the Federation, their college, that they are familiar with the new exam format before they're allowed to examine PACES 2020. And essentially the minimum will be to complete an online training module, and within that module there will be a multiple choice questionnaire at the end that they will need to pass to be accredited. So I think people should be reassured that no examiner will examine unless they are familiar with the new format.
There has been some concern raised that these new changes in the exam may disproportionately affect candidates that are non-UK trained. I just wondered what your response would be to those concerns.
Yeah, I think those are concerns that we hear not uncommonly, both in relation to the current exam and potentially the new one. I think fundamentally I would say that I could allay those fears. We know that in the current exam there are some components of the exam that different groups find easier or more difficult than others. And certainly some overseas candidates or overseas trained candidates find both the communication skills and the history taking station potentially quite challenging, probably for linguistic reasons and in some cases cultural reasons or many other factors. The new PACES 2020 to some degree does have a slightly greater emphasis on communication, although the actual number of judgments in communication skills is unchanged. So I don't think there is going to be a fundamental change. The change is quite subtle in the sense that we're moving to 2 communication encounters, which are perhaps more about interactive negotiation rather than more passive history taking. So that might be a little bit harder, and that's some of the reasons why we've put that change in to actually reflect real life practice. But I think these are things that, like most of the aspects of the exam, the key to success is familiarity with the format and relentless practice. So I don't think these people will be disadvantaged, and I would just simply suggest that they need to make them sure they're familiar with the format and practice carefully beforehand.
So thank you, Dr Harvey, for coming to speak to us today about the changes for PACES 2020.
It's been my pleasure.
And if anybody would like any further resources, there's information online on the educational portal of the Royal College of Physicians of Edinburgh, and there's further information on the MRCP UK website.